Now, our final guest is Dr. Dan Sperling. And many guys are afraid to have the prostate-specific antigen or PSA test done because they're afraid if the results come back elevated, or if they find out that they do have prostate cancer, that they're going to have to undergo a lot of biopsies and treatments, and they just don't want to know. Now, the interesting thing is Dr. Sperling has pioneered a new way of doing testing and of treatments for the low-grade tumors using an MRI instead of an ultrasound. And he's going to explain why this is so much better. But it's going to be very important to understand that this information is available, because if you are a man and you may at some point have an elevated PSA, or you know a man who may have that done, you're going to want to have this information because it's so much better than the standard way of treating and diagnosing prostate cancer right now. So here's Dr. Sperling.
I'm here with Dr. Dan Sperling, and he's the Medical Director and Chief of Interventional Radiology at the New Jersey Institute of Radiology in Carlsbad, New Jersey. So that's a whole lot. And we'll explain that interventional radiology actually is someone who, we know that a radiologist focuses on X-ray, but now they do so many other things. They work with MRIs and all the different diagnostic equipment. And an interventional radiologist is somebody who's able to do procedures as well. So he's going to have a lot of information for us. He really focuses on prostate tumors and the treatment of prostate cancer. So I think it's wonderful to have him on the show, and we're going to be able to learn a lot more about the diagnosis and the treatment of the different modalities available. So, Dr. Sperling, it's great to have you on the show. Thank you for being here.
Thanks for having me. I appreciate it. This is a great opportunity for me to be able to go over with your listeners some of the exciting new revolutionary treatments that have become available now for prostate cancer patients. Up until now, really the two mainstays in treatment have been radical prostatectomy or radiation therapy. But now with MRI and the new emerging technologies, it really avails us of some very exciting opportunities to treat prostate cancer as more of a chronic disease rather than an acute disease that needs very aggressive treatments.
That's great to know. Can you talk a little bit about how much more often we're seeing prostate cancer? Is it something that's a more common thing now with the population that we have?
Sure. As the baby boomers become older, and there's a growing number of men above the age of 60, there is definitely an increase in the incidence now of prostate cancer, as well as that combined with the very sensitive screening technology that we use, which is PSA. We test in the bloodstream the presence of prostate-specific antigen, which the levels have been going down and down in terms of what we use as our cutoff for prostate cancer that we're suspicious for it. Right now is at the level of 4. So really the incidence has increased dramatically. What it does is also the urologists now feel compelled to biopsy a lot more patients, and they're picking up a lot more low-grade prostate tumors that otherwise would never have been diagnosed until for the course of the patient's life. So really the amount of patients that need to get treatment are now put in this dilemma. What do I do now that I know I have some form of prostate cancer? This really creates a lot of questions for them that they may have.
I can imagine. Let's take one step back and let's talk a little bit about PSA, the prostate-specific antigen. Can you
Sure.
talk about that test a little bit and what it means and what patients actually have happened to them when they hear those numbers?
Sure. So, most patients over the age of 40 will start getting a blood test done called PSA. The PSA really what it means is there's certain types of tissue that are secreted into the bloodstream from the prostate gland. When that gets higher, tumor cells increase the amount of cells from the prostate gland that are secreted into the bloodstream, and then that gets picked up on a higher PSA value. So a lot of other things besides cancer can cause an elevated PSA, such as prostatitis, which is an inflammation or infection of the prostate gland, and other benign conditions, such as even just regular and aging-related enlargement of the prostate gland. So just because a patient's PSA value is elevated doesn't mean that they actually have prostate cancer. It just means that they should get worked up to make sure that that's not the case, and that you would want to pick this up early enough to be able to treat it.
That is good news for patients, because some people get nervous getting those kinds of tests and screening tests because they think, well, I don't really want to know. But it's important to have a screening test like this and to understand that even if your number is elevated, it doesn't necessarily mean that you have prostate cancer. It may just mean that something that's very easy to treat is going on. But the reason that you want to try and catch this early and have the PSA done is that even if it is prostate cancer and you catch it early, there are things that you can do that are much less invasive. And those are some of the things that Dr. Sperling is going to talk about. Maybe could you talk about if they come back with an elevated PSA, what are some of the things that the doctor might do to find out what's going on?
Okay, well, traditionally, if a patient has an elevated PSA, they would be recommended usually or referred to the urologist, who would do something called a transrectal ultrasound-guided biopsy, which basically means they put an ultrasound device into the rectum, and then they take a needle and they sample and take tissue from the prostate gland using ultrasound to guide them. Now, this has always been the mainstay of treatment until the new MRI technology has become available. The problem with ultrasound and using that to biopsy the prostate gland is it's very difficult to see prostate tumors with ultrasound. With an MRI, it's basically, with an ultrasound, you're kind of seeing a shadow of the prostate gland, while with an MRI, you have a high-resolution, high-depth picture of the prostate gland. You can actually see the tumor and see exactly where the pathology or the abnormality is occurring. If there's tumor or infection, you can see the difference with an MRI. This brand new technology is less than a year old. If I do see something and a patient would come into me for an MRI, for a diagnostic MRI, I don't need to use an endorectal coil. Nothing gets inserted into the rectum, which is nice. And I might not even have to biopsy them. And if I do see something, I can have them under the MRI. I can sample exactly, take tissue out from exactly where the suspicious areas are occurring, and I can see those very clearly. While with ultrasound and the traditional way that the urologists do it, it's a little more challenging to see exactly where the abnormality is.
Now, that's actually a really huge thing, that you have the definition that you can actually tell the difference between a tumor and an infection. That's what you just said?
Sure. You're able to really get a very high sensitivity. You can detect tumor and exactly how the tumor looks. I look for several things that you can't see with ultrasound. With an MRI, I can look for increased blood vessel formation, known as angiogenesis, which typically occurs in tumors in the prostate gland or tissues at other parts of the body as well. You can look for tumor tissue has increased cell membrane content. There are a higher number of cells in tumor tissue. So I can look to see a slower flow of water cells into that area of a prostate tissue. And then I can also look for decreased glands or glandular tissue in the prostate gland as well, and that's called the T2 signal on MRI. So an abnormal T2 signal. So these are three very, very useful ways I can look at the prostate gland that until now have not been available in this way.
That's fantastic. And then for the listeners to understand, what that allows you to have happen, if you can really see exactly where the tumor is, versus whether it's an infection. If it's an infection, then you don't even have to biopsy it. If you see it's a tumor, what Dr. Sperling is saying is that you can see actually the tumor and biopsy right where the tumor is, versus with ultrasound, sometimes it's harder to see. You see the prostate, you see the shadowing, and you kind of get an idea, but you might miss with the biopsy. So this is really big news, and it makes things much easier. I didn't know this. This is wonderful. Yeah,
there are a lot of patients that what will happen is they'll have an ultrasound-guided biopsy by the urologist, 2, 3 of those, and their PSA value will keep going up, but those ultrasound biopsies will be negative. So a lot of these patients have to go around for 1 year, 2 years, not really knowing if they have prostate cancer or not. So with this new technology, it can actually biopsy exactly where I see tumor and then if I don't see anything or my biopsy is negative, I can tell them with a very high degree of certainty that they do not have prostate cancer. So a lot of this anxiety that's been present, a lot of men, it really hasn't been talked about in the media, or there hasn't been a lot of awareness. There's really a very nice solution now that's available to them.
That's fantastic. And if somebody has this elevated PSA and you've done the MRI and don't see any signs of tumor and you have this high confidence, does that just mean that they happen to be somebody that their tissue just secretes more PSA and it's not necessarily cancer, it just happens to be them?
Well, there's a number. Every clinical scenario, every patient is different. So, I always work in conjunction with the urologist, and we try to come up with the best solution for that particular patient. Right now, most patients come in after they've had the ultrasound and the workup by the urologist. I do have some patients that come directly to me, and in some scenarios that's good, and we can just follow them. So it all depends on the scenario, how long the PSA has been elevated, how high it is. There are a lot of different scenarios that you have to look at. But, it is really a great tool that we can really provide a lot of comfort, because if this test is negative, I could feel comfortable telling a patient that they pretty much do not have cancer, and we would just maybe follow them up over a longer period of time after a year or so.
That's fantastic. So basically, you're really describing why this is so much better than what our real standard of care is, and this is for diagnosis. Now, are you able to use this kind of modality for someone who's diagnosed with prostate cancer, and is there something that you can do that's better than what we have available now with that as well?
Sure, absolutely. I'll just to go back for one other additional piece of information.
Sure.
A lot of patients don't know when they go in for an ultrasound guided biopsy, the urologist has to stick a needle into the prostate gland 12 to 16 times. Those are a lot of sticks, and it's more painful. There's more of a risk for infection and other complications. With an MRI, when I do a biopsy, it's only 2 to 3 sticks because I see exactly where I'm going, which is a nice advantage and much safer and more comfortable for the patient. But getting on to what you said in terms of treatment, so now the two main treatments that have been available up till now for prostate cancer have been radical prostatectomy, where you surgically cut out the entire prostate gland, and radiation therapy. The problem with prostatectomy, when you take out the whole gland, is there are nerves that run into the prostate gland that are involved in maintaining erectile function, as well as continence in terms of urination and the sphincter of the bladder and maintaining control of urination. So there are a lot of nerves and vessels that are severed a lot of times when the prostate gland is taken out, and there's a very high number of patients who suffer permanent erectile dysfunction after having their prostate surgically removed. In addition, these procedures usually take a couple of hours, and there are complications because it is a major surgery. Even the robot that they've used, the Da Vinci robot, has a lot of complications as well. The other treatment is radiation, where you go into a CAT scanner and they look at your prostate gland and they shoot a radiation beam at your gland and try to destroy the prostate tumor. The problem with that is it is radiation, and there's always an association with organs near the prostate gland that you can create new cancers in. With my treatment, I'm able to exactly see where the tumor is, and in patients with what we call a Gleason 7 and below, or a lower grade prostate tumor that's only in one part of the prostate gland, these guys don't need that aggressive treatment. They don't want, why put unnecessary risk and maybe have erectile dysfunction for the rest of their lives if it's such a low grade tumor. So what we do is we bring the patient into the MRI scanner, and we focus a laser beam exactly the same way we do an MRI biopsy. We put it exactly where the tumor is, and we just burn that tumor tissue.
Wow.
This is really a cutting-edge, very new technology, and it's very safe. The nice thing is this is very safe. I can see exactly where I'm destroying tissue. I know I'm not going to hit any of those nerves or blood vessels that could cause impotence or incontinence, and really it's a very conservative treatment and very safe. Also, the technology also allows me to protect very, very critical structures near the prostate gland, such as the urethra, the bladder, or rectum, which in other types of treatments for prostate cancer could be severely damaged. So I have a special computer software that helps protect those areas, and if the heating should ever go beyond a certain level, the equipment shuts off automatically. There are a lot of safety mechanisms in place for this procedure, which are very nice.
That's awesome. And just so the patients kind of understand this, when you're talking about a laser, a focused laser, what it does is it goes through the tissue, and it very safely goes through the tissue until a certain depth. And the MRI lets you know exactly what depth to have that laser actually burn the tissue at, right? So you're not going to have burns on the outside or anything like that. It's just going to be the exact tissue that you want to be burned. Is that right?
Exactly. It's going to be, as a three-dimensional image, which is the beauty of MRI. So I see in multiple planes, I can see exactly the depth of where I'm going, and I always see exactly where everything is placed on a TV screen or on a monitor. So this is the whole procedure is live, and you're seeing exactly where you're going, as opposed to a lot of other procedures where in some ways you're kind of sticking the needle and you have to kind of guess how far you're in. I'm always visualizing and seeing where I'm going, which is very nice. It makes the procedure a lot safer.
That's wonderful. For the listeners, I'm just kind of reiterating what you're saying because you made so many wonderful points. The one treatment, the radical prostatectomy, it actually cuts the prostate out, and you can damage the nerves that can lead to loss of ability to have erections or incontinence. With the radiation, unlike this focused laser that doesn't damage anything until it gets to the tissue, the radiation can damage, it's not quite as fine, so it can damage other tissues like the urethra, the bladder, the bowel. You can have other problems because of the radiation, and this particular treatment doesn't do that. And so I think that's wonderful. That's fantastic.
Another thing that I should mention is cost, first of all, too. A lot of these other procedures, the cost for radiation could be over $60,000, and cost for, the radical prostatectomy, if you consider all the other comorbidities associated with the other problems, it could be very expensive and obviously very traumatic for the patient. So this kind of type of procedure, there's no anesthesia needed. It's done in under an hour, and the patient leaves about a half an hour after the procedure, and they're very comfortable. I mean, I've seen great results, which is very promising. So, a lot of men will be very averse or afraid to go for workup or even look for elevated PSA, but now we have a really nice option to tell them, hey, listen, that's not the end of the world. You have an elevated PSA or you end up with a low-grade prostate tumor. There's a very nice option now that's available for them to treat this.
So now we have a better way to really biopsy and know what's happening. And then once you biopsy, if you do find a prostate cancer, you're really able to essentially treat it in about a half an hour to an hour with no anesthesia. That's essentially what you're saying, right?
Yes, absolutely.
That is fantastic. I love it. Now, how did they develop this? How have you been able to be trained and know about this and to perform it?
Well, this is very new technology. The actual MRI has been around obviously for a very long time, but the actual software that we use to process the images and allow us to see this new information, such as increased blood vessel formation in tumor tissues, to look for a slow flow of water molecules in tumor tissue, that's very new. And we're talking about a year in development. So I have a very strong number of urologists, a large number of urologists that send me cases. So really, they're very excited about this new cutting-edge technology and what it can offer them, because a lot of them don't want to use the aggressive treatments that have been only available up until now to treat prostate cancer. They have a lot of patients with low-grade tumors, and this really gives them a wonderful option to say, hey, listen, instead of maybe even just watching this, some of them should choose to do that. That's called watchful waiting. They'll watch low-grade tumors. Now we can actually treat these tumors and follow the patients very carefully, and we see wonderful results, and not have to go through the whole radical prostatectomy or radiation with all those complications that may be associated with that. As well, there's another treatment that's used. It's called high-intensity focused ultrasound, or HIFU, which is not FDA approved, and a lot of patients actually spend a large amount of money and they travel overseas to Bermuda or to the Bahamas and have U.S. urologists do these procedures. The problem with that is that it is not FDA approved and the regulation is not is limited. My procedure is FDA cleared, and you can do it, of course, in the United States, which it's much more accessible, of course, than a treatment like that.
That is wonderful. Once these patients are treated, and obviously you're going to follow them very closely with PSA, are there things that you can recommend to the listeners to reduce their risk of prostate cancer, or things that they should be doing to try and limit that risk?
There has been a lot of research into what the etiology or cause of prostate cancer is. That has been linked to certain viruses, the different supplements you can take, such as lycopene, that can help prevent it. But, still in terms of lifestyle and just staying healthy, it just would be the type of approach any other patient would use to prevent any type of cancer. But in terms of anything specific, I think the best thing you can do is just have get periodic checks, just like with everybody's accepted getting a colonoscopy at a certain age. And this is the same thing. If you get a PSA check and you pick it up early enough, and if you could pick these up at the earliest stage, they're extremely treatable. And the patient can now go on and have a normal life.
Very, very cool. And at what age would you recommend that men start having their PSA checked?
Above the age of 40, I would recommend.
Okay. So start checking at the age of 40, which is great. And then obviously if they're normal, then that's great. We'll just keep following them. And then if they have any issues, they can visit your lovely neck of the woods. Now, where else is this procedure being offered?
Well, right now I've done the most of this in the United States and actually probably the world. In terms of I'm actually developing a program with multiple centers throughout the East Coast. I have a contact now in California as well who has tried to start working on this, but in terms of the laser ablation portion, I'm the only one doing it in this method it's called the transrectal approach. Other hospitals have tried to do it doing something called the transperineal approach, which is a surgery. And there's a lot more risk that's associated with that. But in terms of the approach I'm using via the rectum, which doesn't need anesthesia, right now I'm the only one really doing it this way. But I'm hoping to train in the near future to train more people and hopefully make this procedure a lot more available to many patients throughout the United States. But anybody is welcome for any part of the country to call me at any time, and we can give them links to my website, and I'd be happy to discuss their case with them, because I do have people flying from all over to have this done now.
And that was my very next statement, is how can my listeners get a hold of you?
Okay, so they can go to my website. It's SperlingLaserAssociates.com. or my name, dansperling.com, and all the contact information is in there.
Beautiful. I will make sure that I have that listed on the information regarding the show so that we can get you situated, because I think that it's a fantastic procedure. And one of these things where I hate seeing the morbidity with a lot of the other issues, and morbidity for the listeners is just the things like with the radical prostatectomy, the incontinence and the long-term erectile dysfunction. And it's so great to know that the low-grade tumors have this kind of an option, and they don't have to do the watch and wait or have the higher level procedures. So that's wonderful.
And I really want to get the word out there because I think this is a wonderful new treatment that really will help millions of people, and we just really need to make patients aware. So I'm really thankful for that you gave me the opportunity to do that on your show.
Well, I'm so thankful to have you on, and like I said, I love the fact that there is this option. So I will definitely have you back on for updates, and we'll make sure we get the word out for you, all right?
Okay, great.
You take care. Bye-bye.
I want to thank Dr. Sperling for an amazing interview, great information, and remind you that you can reach him on his website, dansperling.com. So it's DANSPERLING.com. And I want to thank you for joining me this week. We had 3 great interviews. Remember, visit my website, draliciastanton.com, for more information and to sign up for my newsletter. And remember that what you do today matters tomorrow. We'll see you next week. Take care.